Assalamu alaikum friends, I am your host Taiba Nazim. Today we will discuss about heart diseases under the subject of toxicology. So first of all, we discussed about the heart diseases. Those diseases that affect the heart, there are several diseases like cardiovascular diseases, heart arrhythmia, congenital heart diseases, cardiomyopathy, heart diseases caused by heart infections, and heart valve diseases. So, first of all, we discuss the cardiovascular diseases in detail. Cardiovascular disease narrowed or blocked blood vessels of brain or heart. Symptoms, if we talk about the symptoms of cardiovascular diseases, short breath or pain in the thoracic area or in the center of the chest. These are the common symptoms of this disease. So, next is the risk factor of cardiovascular diseases, or we say the causes of cardiovascular diseases: unhealthy diet, physical inactivity, smoking, alcohol consumption, high blood pressure, diabetes, high blood cholesterol, obesity, etc. These are all the causes of cardiovascular diseases. So, next, the types of cardiovascular diseases. Number one is coronary artery disease. Coronary means major blood vessels, means it affects the major blood vessels. Next is cerebrovascular diseases. It affects the blood vessels of brain. Number third, peripheral artery disease. It affects the blood vessels of arms and legs. Peripherals means cider areas, उसमें arms and legs. Rheumatic heart diseases. There is a bacteria known as streptococcus bacteria causes fever, and this fever causes the weakness of heart muscles and valves. Congenital heart diseases. Number fifth, it is the birth heart diseases. Means at the time of birth there are some certain diseases caused in the heart. Number six, pulmonary embolisms. It causes blood clots in the leg veins. Next, there is a difference, short difference, very important short question: heart attack and stroke. Heart attack, pain in the center of chest, heart discomfort of left hand. If you find these symptoms, then you have high risk of heart attack. Shortness of breath, fainting, nausea, vomiting, sweating, etc. So, what is the stroke? Stroke is sudden weakness of one side, one leg, one face, or one arm. Numbness of one side, difficulty in speaking, saying, walking, or loss of balance. So, there is a difference between stroke and heart attack. Thank you. So next are types of cardiovascular diseases. Number one is coronary artery disease. Number two, cerebrovascular disease. Number three, peripheral artery disease. Number four, rheumatic artery disease. Number five, congenital heart disease. And number five, six, pulmonary embolism. So first of all, coronary artery disease, it affects the major blood vessels. Major blood vessels means arteries and veins. Cerebrovascular diseases, it affects the blood vessels of brain. This word cerebral means brain से ये word derive हुआ है, तो ये diseases भी brain के related ही होंगी, blood vessels जो कि brain को supply करती हैं blood. Peripheral artery diseases जो कि peripheral areas, cider areas, for example arms और legs, इसकी blood vessels के अंदर affects करेंगी. Rheumatic heart diseases, streptococcus bacteria that causes the fever, and this fever causes the weakness of heart valves and muscles. Congenital heart diseases are the born diseases of heart. Pulmonary embolisms cause the blood clot in the leg vein. So next, very important difference between heart attack and the stroke. Heart attack, if we talk about the symptoms, the pain in the center of chest and the discomfort or pain in the left arm or left shoulder. So shortness of breath, fainting, nausea and sweating. These are all the common symptoms of heart attack. While in stroke, sudden weakness of one side, one leg, one face, or one arm, numbness of one side, difficulty in speaking, saying, walking, or loss of balance. These are the common symptoms that are included in stroke. So, this is the difference between heart attack and the stroke. So, number two is the heart arrhythmia. So, heart arrhythmia, it is the irregular pattern of heartbeat caused by the lack of proper electrical signals These may be fast or slow patterns of heartbeat. You know, the electrical signals of heart is discharged from the sinoatrial node of the heart that is present or located at the atrium. So next is the symptoms of heart arrhythmia. Fluttering, poundings are the racing feeling in the chest, fast and slow heartbeat, chest pain and shortness of breath. So the types of heart arrhythmia: tachycardia, bradycardia and premature heartbeats. What is tachycardia? Faster heartbeat means a heart rate is greater than the 100 beats per minute, while in the bradycardia, slow heartbeat or the heart rate is lesser than the 60 beats per minute. While premature heartbeats means there are extra beats that alternate or change the regular pattern of heartbeat. So some are the premature beats or extra beats are come from the top of chamber of heart, that is from atrium. It's known as premature atrial contractions. While the heartbeats are premature heartbeats that comes from the bottom of the heart called as premature ventricular contractions. In number three type of heart diseases, they include congenital heart diseases. It defects in the structure of heart at birth, while the symptoms of congenital heart diseases pale gray or blue skin color, swelling legs and abdomen and around eyes. In infants, shortness breathing while feeding and poor weight gain. While number four, that is the cardiomyopathy, discussed in detail here. It affects the heart muscles. Symptoms: shortness of breath, swellings, ankles and legs, bloating of abdomen, fatigue, irregular heartbeat, fainting and dizziness, etc. Number fifth, that is the heart diseases caused by heart infections. So there are some certain infections that causes diseases in heart include: there are three types of inflammation into the heart muscles, that are pericarditis, myocarditis and endocarditis. Pericarditis involves inflammatory infections into the pericardium of the heart. It is the outermost layer that infects the fibrous sac of heart. While in myocardium, it is the inflammation into the myocardium, that is the middle thick layer of heart. While in the endocarditis, it is the inflammation into the endocardiums, that is the inner lining of heart muscles. So, if we talk about the symptoms of heart diseases caused by heart infections: fever, shortness of breath, fatigue, swelling in legs and abdomen, heart irregularities pattern, dry cough, and rashes on skin. These are all the symptoms of heart infections that causes the heart diseases. The next disease of heart disease is heart valve disease. It includes four major valves: mitral valves, aortic valves, tricuspid valves, and pulmonary valves. When there is a disease in these valves, this causes the blockage of the flow of blood into the heart. So, first of all, we have to know about the normal flow of blood into the heart. Normally, in mitral valve, blood flow from left atrium to the left ventricle, while in aortic valves, blood flow from left ventricle to the aorta and to the body parts. While in tricuspid valves, blood flow from right atrium to the right ventricle. In pulmonary valves, blood flow from right ventricle to the pulmonary artery and to the lungs for oxygenation. So next, symptoms of heart valve diseases: short breath when patients active are working, chest pain, heart valves, stenosis, cough up of blood, and swollen feet and ankles, and lethargy, etc. Risk factor causes of heart valve diseases: advanced ages, family history of heart diseases, smoking, malnutrition, etc. While in the complications of heart valve diseases may be lead to the heart attack, stroke, and heart failure, etc. These are all the six diseases of heart, that is the cardiovascular disease, heart arrhythmia, congenital heart disease, cardiomyopathy, heart diseases caused by heart infections, heart valve diseases. So next step is to know about the diagnosis of heart diseases. So there are some tests that are performed to diagnose the heart diseases. Number one, blood test, very simple test. Number two, X-ray scan. resonance imaging, MRI, cardiac magnetic resonance. Next is electrocardiogram, that is ECG, cardiac catheterization, cardiac biopsy, cardiac computerized topography, that is known as CT scan. Next is treatment of heart diseases. It includes adopting healthy lifestyle or healthy diet, medications, surgical treatments. In medication includes aspirin, statin, beta blockers, angiotensin converting enzyme ACE inhibitors are used as medicines for treatment of heart diseases. While the last step of the severity or chronicity of the heart disease used is the surgical treatment. In surgical treatment, there are some parts that can be removed or add to the heart. For example, coronary artery bypass, vascular catheterization, valve replacements, heart transplant, artificial heart transplant, etc. Next is the preventions. Congenital heart diseases cannot be prevented. Those diseases that are by born, these cannot be prevented. But some that are acquired, we can change our lifestyle. For example, stay away from smoking, normal blood pressure maintenance, fats and cholesterol level, regular physical exercise, healthy diet, and these are all the factors that can reduce the stress level. Okay, that's all from the heart diseases. If you have any query or question, you can ask. Thank you.